everybody, and welcome to Ecophysiotherapy Presents Health, Wellness, and Lifestyle. Today I'm working with Sarah Mason, a certified doula, and we are presenting our second presentation, which is on optimizing labor. So please note this is a pre-recorded message, but her and I, while it's airing live on Facebook, will be live via chat to answer questions. But this is a pre-recorded video. Okay, so today's topic is optimizing labor. My name is Madelaine Golec, and I'm a pelvic health physiotherapist. And
I'm Sarah Mason, and I am a birth doula and Lamaze certified childbirth educator.
Yay! Okay, so this is just to kind of get a little bit more in detail about who we are. So I am a first-time mom of Alice, which you can see in the picture. She's waving to say hello to everybody. And I'm a graduate of McMaster from 2002, and I started in pelvic health in 2004. And I've been practicing only pelvic health since 2016. And in my free time, I like travel and doing Brazilian Jiu-Jitsu.
I am a certified birth doula, a postpartum doula, and a Lamaze certified childbirth educator. I've been working in this industry since 2009, and I have 4 kids, and I like to play board games with them in my spare time.
Okay, so this is just a quick overview of what we're going to be discussing in this presentation. So some anatomy and physiology of labor, a little bit about the expulsion reflex. If you haven't heard of it, we're going to talk about it. What to do and not do during labor, and how to bring the baby down. So a couple of other things are options for staying relaxed during labor, how your partner can help, what is pain, and then we'll talk a little bit about our contact details at the end.
Lots of good stuff.
Yes. Okay. Do you want to take this one?
Sure. So we're going to talk a little bit right now about the anatomy and physiology of labor. So the uterus has vertical muscles and horizontal muscles. The vertical muscles are the outer muscles, and the horizontal muscles are the inner muscles. So the vertical muscles have to contract and flex to open and thin the cervix, and the inner muscles stretch and allow the baby to progress down. So a lot of this process is happening automatically without you really even having to focus or concentrate on anything. It just happens. Your body just does it.
Yeah, which is amazing that, we don't really need to do very much. And that's the beauty of labor. This is, something that we've been built to do.
So we're going to talk a little bit about the expulsion reflex. So that sounds a little bit technical, but what that actually is the urge for your body to push your baby out. When all goes well, everything works together so that your body just does this automatically. This reflex is started by hormones. So there's a huge hormonal cascade that happens during labor and birth that works to create this natural urge to push your baby out. It usually occurs during the end of your labor. Sometimes you can start feeling this urge before you're fully dilated. But it does tend to happen near the end when you're almost there or almost done. If you're fully dilated and you've started feeling the urge to push, you can listen to your body and bear down with the urges gently. If you do happen to have an epidural, you should still feel pressure at this point in time. So if you have been dilated for a little while with an epidural and you can't feel pressure, that might be something that you can talk with your healthcare team about, and what they may suggest is turning down your epidural at that point. It doesn't mean that you're going to start feeling the same feelings that you were having when you chose to have the epidural, but it is going to allow you to have a little bit more sensation so that you can feel the pressure of the baby moving down. We're going to talk a little bit more about this in our next video.
Yeah, and just remember, guys, this is, it just happens. Like, I remember in my, labor, it was just like, I said to my midwife, I'm like, I don't know. It feels like I just want to pushed down. And she's like, all right, let's check to see. And she's like, yeah, we need to get you to the hospital. Like, you know, you're pretty close to, you know, being fully dilated. So it wasn't as overwhelming, but it became more and more overwhelming where my body just literally did it. Like I didn't even think about it. I just kind of like pushed with it.
It's like trying to stop it is somewhat like trying to stop yourself from having a hiccup or a sneeze, right?
That's a good way to think about it. Okay.
So now we're going to talk a little bit about do's and don'ts during labor. So this is a big one. Madelaine and I were actually discussing this one a little bit more in depth in preparation for this video. But one of the really important things is if you think you're in labor and you're not sure whether it is pre-labor or early labor, a lot of the time women, especially when it's their first baby, get really, really excited and think, oh my gosh, I have to clean the house and get ready to go and everything like that. Really, the best thing for you to do at that point in time is to sleep, because you don't know how long your labor is going to last, and you might miss your window for sleep otherwise. If it's not labor and it's just your body practicing and getting ready, then you will hopefully wake up well rested the next morning.
Right. So what you're saying is, like, if you start having some sensations of, you know, cramping or, you know, some minimal discomfort that is not quite the pattern that you're looking for labor, that's a good time to sort of sleep, and like your body will wake up when it's time to go. So not to necessarily worry that you're all of a sudden going to sleep and you know, the baby miss the birth. But if you can try to sleep, trying to get rested is always a good thing to do.
I think so women, when their bodies are sort of working up to labor, they can have sort of a crampy feeling that goes on for a few days, a little longer sometimes. It feels a little bit like menstrual cramps. But what women will also start having sometimes is a lot of Braxton Hicks contractions. And those are your body practicing and getting ready. And sometimes near the end, it can really confuse women because they can seem an awful lot like early labor contractions. So that's really the stage. If you're having those, you know, rest and get some sleep.
And of course, you know, contact your doula or your midwife or your doctor if you're like not sure.
Absolutely.
And they can also guide you of like, oh, this kind of sounds like it's more just, you know, some practice. So that's always an option as well. So other things that you want to do during labor is make sure that you have snacks. I mean, labor is going to take a lot of energy out of you. So, you know, if you're packing a bag because you're going to the hospital, like make sure you have something in there to snack on, or if you're at home, you know, get your spouse to, you know, get you to, you know, munch on something.
Fruit's a really good option.
Yeah, because it doesn't really take a lot of effort to eat fruit.
That's right. And it's got some sugar in it and it helps you stay hydrated.
That's good, which is leading us to the next point, which is you want to make sure that you're drinking, you know, enough water. We don't want you getting dehydrated in the process, which will also make you feel like you need to pee, which we encourage women to make several visits to the toilet for whether it's urinating or for a bowel movement, just to make sure that, you know, your bladder's not full and, you know, can lead to some other complications. So you want to be visiting the bathroom.
Did you know that dehydration can change your baby's heart rate pattern?
I did not.
Yeah.
Oh.
So hydration is really, I just want to revisit that before we move on.
Absolutely.
It's really, really important. Even if you're not really feeling thirsty, just having a glass that you're sipping from on a regular basis can make a really big difference.
Yeah, of course. And especially if you're a first-time mom and you don't know that, you know, you don't want that panic to sort of set in.
So our next one is get up and move. So once you have slept and rested at the beginning and you're no longer able to do that, it's a really great way to bring your baby down, which we're going to talk about a little bit more in a couple of minutes. But getting up and moving is a really fantastic way to progress labor.
Absolutely. And, you know, rely on your partner and your support team. They're there to help you and guide you through the process. And, you know, you also want to kind of not have the environment too stimulating. So, if you're able to sort of dim the lights or close the door, kind of reduce the sound, will just allow you to get yourself more into a relaxed, environment.
Yeah, it does make a difference. So even if you're at the hospital, you can, if your labor is more progressed or you need to be there early on, you can turn off the lights in your hospital room and shut the door and just have a little bit of quiet time.
Absolutely.
Yeah. So now we come to the don'ts.
Yes. Yeah.
Yeah.
So as we said, getting up and moving. So you want to try to, not stay in the bed if you don't have to. Moving around will help progress the labor. And same thing, you want to try not to be laying on your back for prolonged periods of time. Again, it could, restrict some blood flow to the baby, could give you some, back, unnecessary back cramping. And again, you want to be in a gravity assisted position that's going to help bring the baby down.
Right. So if you are in a circumstance where you have to be in your bed or you have to be in the hospital bed, doing a sideline position and changing that position on a regular basis. So, every 20 to 30 minutes, if you're able, just sort of flipping from side to side, maybe changing the elevation of your legs a little bit, can really make a big difference. So even if you don't have the benefit of being able to walk around and you are tied to the bed, there are little things that you can do to help the labor progress.
And lastly, don't doubt yourself. What we hope to convey through this educational video is your body is designed to give birth, and the anatomy, the physiology, the way the hormones work, how everything, in most cases, we're designed to do this. You can do this, and you have a support team around you to assist you.
Okay, tips to bring that baby down in the pelvis. Dancing, right?
Yeah, I've seen actually quite a few videos on Facebook of different dance routines. Dancing is great because it kind of gets you into a rhythm. You have music, which can be sort of relaxing. And of course, you're in a gravity position, which is going to help pull baby down.
I think the other thing about that, or the hula hoop movements that we have listed next, is, especially as you're moving from early labor to active labor, you can still be having fun and you can still be trying to make the day a nice day and try to pass the time in a positive way.
Absolutely. That's a really, really good point. So other additional things you could do is squatting down. So even in the dance moves, dancing down to the ground and getting into that squat position. Again, these are great because it helps squats are great because the way the hips are positioned helps to open up the pelvis, which helps to stretch out the pelvic floor muscles a bit, create some downward pressure as you're getting into a squat position. So that's why dancing and getting down toward the ground is really great for bringing the baby down.
In the hospital, in the labor and delivery section of the hospital, just like most of the rest of the hospital, they have a railing that runs all the way along the hallway in the hospital. So if you're trying to get labor going and maybe you're doing a little bit of walking around in the hospital once you've been admitted, when you have contractions, you can use that bar on the side to either rest on and lean forward, or what some women like to do is to actually use that to help them with a squat.
Yeah. But if you find that perhaps your knees or you just kind of can't get down into a squat position, perhaps sitting on a ball or the toilet. And if you're on a ball, you can even do kind of hula hoop movements on the ball supported if that's much more comfortable for you.
Walking is the next one that we have. So you don't want to spend your whole labor walking. You really want to alternate with more restful positions, but sort of walking for 25 or 30 minutes and then spending a little bit of time maybe sitting on the ball in a more restful position. Yeah. And then after you've done that for a little while, getting up to walk around again can be really, really helpful.
Absolutely. And your partner's there for support. So there's a variety of positions that you can work on, but just mainly even hugging and just, even going into a semi-squat during one of those, powerful contractions and your partner being there for support can be quite helpful. And the last two are more like if for some reason you are laying down, as we said, there's some positions you can change. So you could even do like a frog or cobbler's pose where basically you're laying on your back, your knees are bent, so your feet are flat on the table, and you just allow the knees to open up, whatever's most comfortable. You can even prop pillows under the knees so that if you're not as flexible, that your knees are supported and you can get into a nice relaxed position. And that's when you can practice your deep breathing. Remember, the diaphragm muscles are up in the rib cage. You can't really see, but they come down, right? As we inhale, it comes down and helps to push everything else down. So don't underestimate the power of really good deep breathing techniques. And the same thing with a side lying position where your knees are sort of propped open. Again, opening up the pelvis opens up the pelvic floor and creates more space for the baby's head to come down.
I always tell my clients to bring extra pillows, and that's what we use those pillows for a lot of the time. So if you are having your baby in a hospital, and most people do, pillows are a hot commodity and they're really hard to come by. So I always tell people to go to the store and buy some really cheap pillows that you would feel comfortable throwing out after the birth, if need be, and use them for purposes like that.
An absolute must. I mean, I went out and I bought four pillows. I ended up taking 3 with me to the hospital. I had to spend, a night there, and like their pillows aren't really that fluffy, but I had, it was great because I had pillows to hug, I had pillows for my knees, which was even helpful after the delivery as well.
I think most pregnant women can relate to that because you spend a large chunk of the last trimester trying to get into a comfortable position in bed. So that's when women buy those body pillows, or they end up buying a whole bunch of pillows to help them. Yeah. So it's the same thing when you go to the hospital to have your baby. You need to be comfortable, and pillows can help you with that.
Yeah.
Okay, so now we're going to talk about options for staying relaxed during labor. So these are just some suggestions, what might work for you. And this is by no means an inclusive list. So if you can think of something else that helps you in particular, that should be on your list of things to do to help you stay relaxed during your labor.
Absolutely. And some of these things might work for some ladies, doesn't necessarily work, for others. But, a couple things like, breathing. I mean, it's so simple. You don't need any extra, things. You can use your own body's natural movement patterns to help you with the labor. And of course, our diaphragm muscles connected to our nervous system, so it can help kind of calm down our nerves, especially if you're first time mom, like you're all excited, you don't really know what's happening. So it's taking some time just to like breathe, meditate, visualizations on the list. Those are great ways to be relaxed.
So as far as the meditation goes, what some people will do is they will download guided meditation podcasts. That can be a really, really good idea. So you can have it on your phone and you can listen to it with headphones during your labor, or you can put it on in the room. That's all right as well. Music, I always suggest to people to have music of a few different speeds, because maybe if you haven't been in labor before, you're thinking what you want is slow, relaxing music, and you do. But there might be certain parts of your labor where you feel like listening to something a little more energetic. So put a variety.
A little more intense while you're going through a little more intense feelings.
That's right. Massage. So massage can be really helpful. And you can get your partner to help you with that.
Or a doula, if you hire one.
That's right.
A great reason to hire one is for that hands-on technique to help you with positions, as well as hands touching body, also helpful.
Absolutely. So you can do firm massage or you can do soft touch massage, whatever is feeling good to you at the time while you're in labor, because it will change. You can do a bath or a shower. So they have showers at the hospital in all of the rooms. Whether or not there's a bath available is something that you have to find out about the particular hospital that you are delivering at. But all the hospitals in our area have showers that you can use.
I didn't know that. And then, of course, if you're at home, then you have access.
That's right. So this is something that not too many people know about, but we use them with all of our clients, and it's called a TENS machine. So I know that you use TENS machines in your practice as a physiotherapist as well.
Absolutely. So you might be wondering what TENS stands for. It's transcutaneous electrical neurostimulation. It's a really long word. That's why we like to just call it TENS. And basically it's using an electrical current to, stimulate the receptors in the area and kind of just give it a different signal other than the ones that it's experiencing. And that can sometimes help dampen down the intensity of the, contractions.
Visualization. So this is what I was talking about a minute ago when I mentioned that you can get guided meditation. So a lot of women find using visualization really helps get their mind off of what's going on if things are particularly difficult during their labor. So that can be helpful. And it's also important to imagine yourself laboring effectively, right? It's just like when we exercise. If you go and exercise and in your head you're thinking, I can't do this, what's going to happen? Your body's going to stop doing what you want it to do. Whereas if you visualize yourself being successful doing your exercises, it makes it easier to get through. So the same thing can be used during labor.
Absolutely. And also, guys, thoughts are electrical chemical impulses. Like, it does play a role on our physiology. So if you're thinking I can't, your brain and your body is going to work toward making that true. Versus if you think I can do this, then your body and your brain will coordinate to make sure that you're successful. So whatever you believe, that's what's true.
So the next thing on our list is hiring a doula. So doulas can be a really fantastic support for both you and your partner. We do a lot of work with partners as well to make sure that they're feeling comfortable. But a doula can really help you know what's going on and give you suggestions for how to manage your labor in a more effective way.
It can help your partner get more involved. Like, the doula's not there to take over your partner's role. The doula's there to make sure everybody's involved and safe and comforted.
It actually has been proven that dads are more hands-on with their partners when a doula is present at the birth.
That's awesome. That's amazing.
So what else is helpful is just working through your fears before the birth. So if there are things that keep popping into your head that are making you concerned, try and work through them before you get to the big day. So talk to your care provider about them. Take a prenatal class. So Lamaze classes can be really, really helpful in assisting you in working through some of the fears or concerns that you might have.
Absolutely.
You don't want to save them to deal with on the big day.
True.
Yeah.
And even, pelvic floor physio, doing a session with a practitioner like myself can really help you learn how to relax the pelvic floor muscles. Because obviously one of the things that women fear a lot about is how much trauma to my body is going to happen as a result of labor. And so we work through that beforehand, right?
That's a big one.
It is a big one.
Yeah. So how can your partner help you? They can take a prenatal class with you, offer encouragement and reminders to breathe.
That's a big one.
Yeah.
Because in the midst of it, you may be practicing breathing and you're like, I'm ready to do this. And then in the midst of an intense, series of contractions, it's hard to breathe. And I remember for myself, and I just remember my partner saying, you need to take a deep breath, you need to take a deep breath. And at least that's what I was trying to do, versus if somebody's not there reminding me to do that, I may not try to do it.
It's really helpful for most women to have somebody work through each and every contraction with them as things become more intense during their labor. Not so much during the early labor stuff, but once things really get going and you move into more active labor or transition, having somebody guide you through either verbally or through touch through each contraction can be really, really helpful. It can also be helpful during those contractions to do massage, right?
Yes. And having your partner doing that. And it's really good that, if you've planned out sort of your birth options and how you kind of see your birth plan, your partner is there to advocate for you. When you're sort of in the midst of it, you might not have the energy to talk about what you want. It's something that you've already discussed with your partner. Your partner can be helpful with being your voice when you might not be able to.
Mm-hmm. They can also remind you of how strong you are. So give you that verbal encouragement the whole way through and help distract you. Sometimes moms really like to laugh. Yeah. You wouldn't think so, but sometimes they do. And your partner knows you better than anybody else, right? So they know what's gonna help you to take your mind off of things and de-stress you in the moment.
Absolutely.
Right. So we talked about working with you through each contraction, right? That's really, really important. And they can help you to find your rhythm. So a lot of the time, what will happen as women move into active labor is they will start doing the same thing through each contraction because their natural body movements are what's helping them to manage the discomfort.
Absolutely.
So they can help you do that. They can help you sway back and forth. They can help you vocalize. They can help you breathe. And the last thing we have on the list is that it's really important to maintain physical contact with your partner during your labor. That can be really, really helpful. It gets your oxytocin going.
Yep.
Right.
Which is the hormone that, is very active with labor and delivery. And it can be simple. It can be like holding hands or having them stroke your arm. Remember, in that rhythmic, very gentle, or maybe a little more firm, rubbing your shoulders, hugging you from behind, whatever happens to be the best option, that can also aid in the labor.
Right. And what I do want to say to partners is sometimes moms can be a little bit touchy during labor. So if you try something and she says, stop doing that, or don't do that, or I need you to stop, that's fine. Respect her wishes, but come back with another suggestion and come back with something else that you can try. Don't feel like she wants you to exit the situation when that happens. It's just that the physical sensations she's going through are incredibly strong. Yeah. So sometimes she might need to put up a hard barrier.
Absolutely.
But do try something else.
That, or just, be close by, just kind of sit beside her, be close by, and just say, I'm here when you need me. Right?
But offer, because sometimes women can't ask
in
labor.
can I do anything for you? Yeah. So that's a good point as well.
What I would suggest, rather than open-ended questions, is say something like, I'm going to try, and then fill in the blank. I'm going to try this on the next contraction. So maybe I'm going to try some counter pressure on your hips. We're going to talk about that in an upcoming video. But I'm going to try some counter pressure on your hips on the next contraction. So you tell me whether or not it feels better or worse.
That's a great idea.
So you go ahead, you've warned them. So you go ahead and you try it and then ask them afterwards, did that help? And a lot of the time you're going to get the answer, yes. But if you say something like, is there anything I can do to help? A woman in labor might not be able to brainstorm, but that's what would be helpful.
She's kind of busy mentally.
That's right.
That's a good point. Yeah, I didn't even think of that. Okay, so we're going to talk a little bit about what pain is, because I think that's a really big fear that women have when approaching labor, like, I don't know if I can take the pain. So I just kind of wanted to put up what the actual definition of pain is, and then we'll talk a little bit about what pain is. So the International Association for the Study of Pain defines it as an unpleasant sensory and emotional experience that is associated with actual or potential tissue damage, or is described in such terms of damage. So basically, pain is an alarm system, right? It's a warning system. It's letting you know that something is changing, something is different. Like, it really wouldn't be useful if we broke a bone and then got pain, right? Like, or rolled our ankle and then we got pain. Like, the pain usually starts beforehand to let you know, hey, something's stretching a little bit, too much, gives us the opportunity to change and get out of sort of that perceived danger. So the same thing with, labor. If you are experiencing discomfort, that's just the alarm system letting you know something's happening, like, that requires your attention, because that's the only way your body can really kind of communicate that to you.
Right. It's telling you something big is about to happen, so you need to get to a comfortable, safe place. That's the reason for it.
Absolutely.
It wouldn't be very safe if we didn't have any kind of alarm system and just sort of delivered our babies in the grocery store by surprise, right?
Exactly, right? It's that warning, and pain's purpose is about safety, right? And survival. So you might be experiencing discomfort from a variety of different reasons. So we have different receptors in our body that detect changes, and that could be changes in temperature. Obviously, like if I'm approaching a hot stove and I feel heat, like my brain needs to be able to respond to that. But with respect to labor, there's a lot of pressure happening, right? There's a lot of pressure, vibration, compression, and that's likely what's stimulating those receptors and sending those signals up to your brain. And of course, other receptors could be like changes in the chemical composition. And of course we have stretch receptors that are detecting, hey, there's a stretch. So for example, if I take my finger and I bend it, I start to feel a stretch. At some point, I feel some discomfort, letting me know, like, hey, just letting you know if you keep going. But nothing bad has actually happened, right? So having discomfort doesn't actually always mean, oh, something's damaged or something's, something bad's happening. It's just, it's a warning system.
Okay, so we're going to talk about the key points about pain. So like Madelaine just said, in most cases, pain during labor does not signal damage. It's safe, but it's sore.
Right.
So how can we deal with that?
Well, the thing is we want to surround ourselves by positive birth stories. One of the things is like when you continuously hear about, negative stories, that kind of already builds you up and makes you actually more tense, which usually results in more discomfort because you're not relaxed. You do not feel safe. And pain is really about threat. It's about perceived threat or actual threat. So if you're listening to negative stories, you have a perception that labor is a threat. And as such, your body will intensify the signal. So you want to surround yourself by positive birth stories. And that just leads into point 4 that like language matters, right? Like, make sure that you're reading positive stories or positive blogs or hearing language of like, you can do this, that matters.
Visualization helps. These things are not necessarily going to change the outcome of your birth or how your birth goes, but it will change your experience of the whole process.
Absolutely.
Right?
It's all about mindset, setting your mind prior to the task, like, we can do this, I can do this, really helps in the end. Which leads into point 5, which is remember that you are strong and that you can handle this. Like humans have been giving birth since humans basically came into existence. Like we've been doing this.
And if you're managing to maintain calm with your partner, you can handle just about anything that happens, right? As long as you have enough information to make good decisions, you can handle this, even if it doesn't go the way that you hoped that it would.
Absolutely. It's minimizing that threat factor. And I just wanted you to know that like the sensations in your body and the emotional experience of those sensations can be heightened by fear. And the other thing is that fear tends to create tension in the body. And when you have increased tension, so when you're sort of pulling inward, that tends to be more discomfort. Because think about it, we're trying to get baby out and we need things open and stretching and opening. But if you're tense because you're maybe experiencing some sensations, you're not getting the verbal encouragement, guidance, it makes it harder and increases the likelihood that you may have more tissue trauma because that baby's still coming out one way or the other, right? So if you can try to get into that relaxed mindset, that'll help the body relax as well.
Oxygen helps with all of that.
Yeah.
Right? So remember to breathe. Okay. So
we have a couple questions for you guys. Yeah. So I guess the first is hopefully, like, did you have a little bit of fun with us today? Mm-hmm. We hope the answer is yes. Did you find our information informative? Like, did you get to learn some things about labor that you perhaps didn't realize?
Mm-hmm. Can you see yourself using any of the positions that we talked about today? Hopefully the answer is yes.
And then our last question is, do you want to learn more? Which we hope the answer is yes. And if you do, that is amazing. And so we want to just provide you some contact details for us so that you can ask us any questions or get some more information about what we do and how we can help. So my contact detail, okay, so our website's there, ecophysio.com. We have a Facebook page. We have an Instagram account. We're on Twitter. Our phone number and our email is there. And I just also wanted to let you guys know that we have a YouTube channel. So if you type in ecophysiotherapy, we have a lot of great educational videos. I have a pregnancy series of videos, some exercises for postpartum. Of course, this video will eventually show up on our YouTube channel as well. So be sure to check it out and subscribe.
Okay. So my contact information, you can find my website at myconfidentbirth.ca, and we have a Facebook page as well, or you can email me to find out more information.
Awesome.
All right. Thanks for watching.
Yeah, that's everything, and stay tuned for the next video. I think we're going to be focusing on the actual birthing, so be sure to stay tuned. Make sure to like our Facebook pages because, of course, we post all the information of upcoming videos and conversations. So anyways,
great.
Bye for now.
Bye.
All right.